Hi, fellow future RNs! I am back. Kasi matagal akong nawala, no? Kasi na-busy ako sa duty ko for the completion of cases. Hindi ko alam kung ba't sinasabi ko, pero wala namang nagtatanong. Okay, charot. Okay, so para po doon sa mga bago dito sa ating channel, ako to, ang auntie nyo, 33 years old, a wife, a mom, and a nurse in the making. So, nag-upload po ako ng videos ng mga nursing study hacks and yung mga simplified na nursing concepts. Today, fellow future RNs, we are going to be talking about glaucoma. Let's go! Alright, so glaucoma is a group of ocular diseases resulting in increased IOP. Okay, so ano ba tong IOP? IOP is your intraocular pressure. Okay, so intra meaning inside, ocular pertains to the eye, and pressure is of course pressure. Okay, ibig sabihin, mataas ang pressure sa loob ng ating mata. Sa loob ng ating mata ay merong fluid. At ang fluid na yan ay tinatawag nating aqueous humor. Ito nagme-maintain ng pressure sa ating mata. Okay, the normal IOP is 10 to 21 millimeters of mercury. Okay, so kapag mas mataas dyan, meaning increased ang IOP. Okay, so ano ang ginagamit na pang-measure sa IOP? Paano natin malalaman kung increased ba ang pressure sa ating mata? So, gumagamit tayo ng tonometer o ang tawag sa diagnostic test na yan is your tonometry. That's what we use to measure the IOP. Okay, so balikan natin yung ating aqueous humor. Sinabi natin na yan ang fluid no, sa ating mata and kapag dumadami yung fluid, nag-increase ang ating IOP. So kapag nag-increase ang ating IOP, pwedeng ma-damage ang ating optic nerve. Si optic nerve or kilala din natin bilang yung ating cranial nerve number 2. And kapag na-damage si cranial nerve number 2 or your optic nerve, that could lead to what? Blindness. For example, ito yung ating mata, no? This is, looking from above. So, kumari, pag kinat natin yung ating, ang head, no, sa half, parang ito yung ating, tawag ito, transverse view. Tama ba, transverse? Sige, bahala na kayo, malaki na kayo. Okay, so, ito yung ating eyes, diba? So, ang ating aqueous humor, dito siya na-form dito sa ating ciliary body. Okay, so fino-form dyan ang ating aqueous humor and then magfo-flow ang aqueous humor papunta dito sa lens, sa posterior chamber, papunta ng pupil, papunta ng anterior chamber. Ang ating trabecular pathway, 90% ng ating aqueous humor dito ang outflow, no? Dito na di-drain. So, dito sa cornea, pupunta siya sa trabecular meshwork na tinatawag. Ganyan yung itsura niya, para siyang drain, and then papunta sa Schlemm's canal, and then papunta sa ating episcleral veins. Okay, so ganyan yung outflow, normal na outflow ng ating aqueous humor or yung fluid sa ating mata. So, from the cornea, dito sa lens, is the drainage angle. Mamaya, magiging relevant siya once we discuss the types of glaucoma. Dalawa ang pwedeng maging problem kung bakit tumataas, no, nag-i-increase ang ating IOP. So, it's either ang problem is sa formation, sobrang madami, no, ang increased ang formation ng iyong aqueous humor or merong problem dito sa outflow, sa drainage. Okay? So, yung dalawang yan, pag nagkaroon ng problem, pwedeng matrap dyan, mag-accumulate ang ating aqueous humor at pag nangyari yan, mag-i-increase ang ating IOP. At kapag nag-increase ang IOP, anong meron sa ating patient? Glaucoma. So again, here's an illustration comparing yung normal na drainage channel. So dito, normal lang na nadidrain yung ating mga aqueous humor. Mula kapag finorm siya, nadidrain siya, normal. Dito kapag may blockage, bumabalik, no, yung ating aqueous humor, nag-accumulate lang siya sa ating eyes. That could lead to pressure build-up and that the pressure build-up could damage your optic nerve kasi nandyan yung ating optic nerve. Okay, so pag nag-increase ang pressure dyan, madadamage sa optic nerve or your cranial nerve number 2. That could lead to what again? Blindness. So, ito yung ating types of glaucoma. Ito yung sinasabi kong drainage angle kanina. Okay, so generally we have two types. Your open angle and your angle closure glaucoma. The open angle glaucoma which is yung pinaka-common na type ng ating glaucoma. It is also known as your primary open angle glaucoma or open angle glaucoma. Okay, so here again, notice, this is the angle na sinasabi ko kanina, yung drainage angle, yung cornea papunta dito sa iris. Kung mapapansin nyo, it's open. Okay, so ang problem kapag open angle glaucoma is dito sa ating trabecular meshwork, it could be clogged or merong obstruction dyan, no, sa outflow na palabas yung ating aqueous humor. Kaya nag-i-increase ang ating IOP. So, again, this is the most common. Usually, ang ating signs and symptoms dito ay silent and subtle. Okay? Usually, ito ay painless. Kung meron man, it's very mild. So, mild to none ang pain sa open angle glaucoma. So, ang kaniyang vision changes ay gradual. Vision changes. Okay? Ang nawawala sa open angle glaucoma is your peripheral vision. Pero dahil nga, gradual ang pagkawala ng vision, it may go unnoticed. Okay? So, at dahil nawawala ang peripheral vision, but the central vision remains intact, anong merong vision kapag open angle glaucoma? It's called your tunnel vision. Ganito yung view kapag may tunnel vision ng ating patients. Now, let's move on to the second type, which is your angle closure glaucoma, or also known as your primary angle closure glaucoma. Dito, it's narrowed, or may blockage dito mismo sa drainage angle. Okay, so hindi labas, no, papunta sa trabecular meshwork, papunta sa ating canal of Schlemm, yung ating aqueous humor. So, nag-accumulate siya dyan, kaya lalong tataas ang ating IOP. So, ang pwedeng mga signs and symptoms ng ating patient is pwedeng magkaroon ng blurred vision. Ang patient natin pwedeng makakita ng halos around lights. Pwedeng magkaroon ng ocular erythema. Minsan, merong edema. Kasi mamamaga yung eyes kasi nandyan lang yung ating aqueous humor na nag-accumulate. Important thing to remember about your closure angle glaucoma or your angle closure glaucoma is this is a medical emergency. So, dapat matreat ka agad. Lalo na yung mga acute angle closure glaucoma, pwede magkaroon ng sudden eye pain and nausea and vomiting. So, again, kapag sa open angle glaucoma, mapapansin natin na open yung angle natin. Ito yung angle between the cornea and the iris. Okay, kapag closed or angle closure glaucoma, mapapansin mo narrowed siya or closed ang kanyang angle. So, good to know lang, no, ano yung ginagamit natin na test or procedure to know, para natin malalaman kung closed ba yung angle or open. So, yung ginagamit na test is your gonioscopy. Okay, moving on to the interventions for glaucoma. Okay, let's start with the pharmacological interventions. Nagbibigay tayo ng myotics. Okay, ang mga myotics is used to constrict the pupils para makadaloy ang ating aqueous humor. So, for example, ang pinaka-common dyan is your pilocarpine. Okay, next, nagbibigay din tayo ng carbonic anhydrase inhibitors to decrease the aqueous humor production. Common din dyan na ginagamit is your acetazolamide. Okay, next, nagbibigay din tayo ng beta blockers to decrease the aqueous humor production and to decrease the IOP as well. So, ang pinaka-common din dyan na pwede nating ma-encounter is your timolol. Remember, beta blockers, LOL drugs. Another good to know, sometimes kapag emergency, no, pwedeng magbigay ng mannitol to decrease the IOP. Mannitol is an osmotic diuretic. Moving on sa ating surgical interventions. Okay, so pwedeng mag-perform ng mga laser treatments to kill the aqueous humor producing cells to decrease the fluid. Pwede rin mag-perform ng peripheral iridectomy which allows aqueous humor to flow from the posterior to the anterior chamber. Another procedure that could be performed is your trabeculoplasty that helps closed angle by punching a small hole in the iris. Pwede rin maglagay ng mga implants na pwedeng mag-bypass doon sa collecting systems and shunt the fluid out. Here are helpful health education na magbibigay natin sa patient after ng surgery. Okay, very important is to avoid added pressure after ng surgery. So, no coughing and sneezing hanggat may iwasan kasi nakaka-increase ng pressure. No bending at the waist, no lifting heavy objects, no nausea and vomiting. So, pwedeng magbigay dyan ng medication para maiwasan ng nausea and vomiting. No Valsalva maneuver or bearing down or yung nagsistrain kapag nagpupoop tayo. Bawal yan. So, constipation is a priority. So, pwede magbigay dyan ng mga laxative para hindi mahirapang mag-poop ang ating patient. No anticholinergics or your atropine. Kasi itong ating mga anticholinergics, nagdadilate sila ng pupil. At kapag nagdilate ang pupil natin, lalong hindi makakadaloy ang aqueous humor. Okay? And also, no diphenhydramine kasi various study shows na nagpapa-increase din siya ng ating IOP. So, that's it for glaucoma. I hope you learned something today. Bye!